好，那两位请坐指定的位置吧。你们要帮我打分数，现在就可以 scan 那个 QR code。来，那玉文，请你就在台上 stand by， 然后呢，我把你的档案开出来。这个是你的，没错吧？看一下。
对。
你可以稍控制一下前后切换会不会？可以吗？然后这个是这个 timer 看得见吗？
可以，
可以，好 ，I ready。它的学号都在上面，所以说你们现在应该可以拿手机出来扫 QR code， 因为你们要用手机报名。好。
好，可以。
So good. Okay. 好，那 you please. Thank you.
Hello everyone, my name is Huang Yuan. Today I'm going to present a journal called Kinesio Taping the Staff Provided Additional Benefit Patient with Chronic Low Back Pain who receive exercise and manual therapy, randomized control trial. Manual therapy exercise as a common effective way to treat low back pain. And kinetic taping is increasingly used to enhance its effects. A study wanted to find out if aiding kinetic taping can make the treatment more better. And here are the methods. There were 148 adults with chronic non-obstructive low back pain. And they were readily divided into two groups. And they were receiving 10 sessions of exercise and manual therapy. And experimental group got the kinetic taping on the lower back. And they were measuring the pain and disability at 5 weeks, again at 3 and 6 months. And all data will be collected by the blinded assessor. That means the person didn't know which group the patient was in. And here are the results. The x-axis is the time, and the y-axis is the pain intensity. And there are two groups. The blue bar is PT, the green bar is PT for kinesio taping. At the beginning, the pain intensity is similar. Then it is decreased, and 3 months and 6 months it does stay down. So it means both groups were not a bit different. So here are the conclusions. Kinetic taping provided no extra improvement beyond exercise and manual therapy. But the exercise and manual therapy are still effective. The main effective treatment for chronic non-obstructive low back pain. And here are my.
Okay. Thank you, Yuwen.
Thank you.
Here I have a very wonderful presentation, and I have a very quick question for you.
Yes.
In the experimental group, what interventions were given in your study? Experimental group intervention. What kind of interventions were given?
Let's repeat again.
Sure. In the experimental group, 实验组, what kind of intervention 治疗 were given? Thank you.
Oh, you just adding the kinesio taping.
Kinesio taping alone or anything else?
On their lower back.
Okay. Thank you. Thank you, 玉文。好，那我们下一位就一真，可以准备一下喽。谢谢。那我们就跟一真换一下位置。好。我拿厕所。哎，好，请拿。试试看。 快好，医生的学号。So, Ethan, are you ready? Let's go.
Good morning, everyone. My name is Huang Yizhen, and today I will present a study titled Immediate Effects of Fonzoser on Pen and Ankle Range of Motion in Patients with Plantar Fasciitis. This study was published in the Hong Kong Physiotherapy Journal in 2020. Strengthening improved pen and ROM is plantar fasciitis. Fonzoser is also popular, but a few studies as its effect. So this study compared fonzoser and strengthening on pen and ankle range of motion. 50 participants randomly divided into two groups, strengthening and fonzoser groups. We use VAS for pen and PPTS for foot muscle and WBLT for ankle motion. All tests were done before and right after treatment. Here we can see the VAS comparisons between strengthening and fonzoser. Before treatment, the two groups is 5 to 6 around centimeters. After treatment, pen decreased in two groups. In conclusion, both strengthening and fonzoser reduce pen and increase ROM. Fonzoser was more effective for core muscles. It can be used to simple short-term treatment for plantar fasciitis. Thank you for listening.
Thank you. It's a wonderful presentation, and I have a quick question. Can you jump to the figure? The slide of your figure.
Oh.
Yes, this one. It went very, very fast. So could you explain to us your x-axis, y-axis, and the colors? Thank you.
That's it.
Sure. The details of the x-axis, what is the y-axis, what is the x-axis, and what are the colors of blue and orange? Yeah, details. Thank you.
Blue is pre-test. Orange is post-test.
Yes.
Now, it has two groups.
And they are
strengthening and fonzoser.
And what is the y-axis exactly?
It's VAS centimeters.
Okay, so don't forget next time, okay? Because you went very fast. Thank you. And 那我们下一位吧。来，交给我。试试看。Okay, so are you ready? Okay, let's go.
Hello everyone. I'm Chongmin. Today I'm going to introduce honestly tapping does not provide attention benefit in patients with corneal pain who receive exercise and manual therapy. First is background and purpose. Background corneal low back pain affects 39% globally major cause of death. Exercise and manual therapy and globally exist but offer widespread purpose to test if aiding KT to exercise and manual therapy improves outcome in corneal 148 adults with chronically non-muscular low back pain, 3 months or more than 3 months. In conversion, 10 sessions twice weekly in 5 weeks of manual therapy plus exercise. Measurement, clinical pain, and the disability. Secondly, verbally perceived efforts and the physical with care. This reasons the X line is KT and the total. The Y line is BS. The red one is baseline. The green one is 5 weeks. And the conclusion. Study conclusion. No adolescent benefit from KT with combined with manual therapy exercise. That is references.
So, thank you, Johnny, for your presentation. I have a quick question for you. In this study, what were the participants' intervention and the outcome, respectively? Thank you. Yes, can you tell?
Patient had 148.
So, what kind of people were joined in this study?
Somebody have common something problem.
Yes, and
they have almost more 3 months.
okay, chronic low back pain. And the intervention, what was the intervention?
Intervention is 2 weeks high speaker and it is can high speaker 5 weeks of they have manual therapy.
Okay, thank you。有点太紧张了哈。好，那谢谢3位，我们可以离开了。那我们从前门好了，我们从前门 OK。来，进来，请进，请进。那我们待会是郑颖先，另外2位的话就帮我坐这边，手机要拿进来。来，桌上有那个 pointer， 你看看能不能操作前后。桌上 pointer， 看看能不能切换前后。就帮忙扫一下，然后把那个郑颖的学号输一下。那你们要跟我一起评分。这个看得见吗？可以。好。So, are you ready?
Yeah, let's see.
Are you ready?
Okay.
Okay, let's go.
Hi, my name is Zheng Ying. I am going to present the article is the acute effect of a percussive massage treatment with a hyperbolic device on pentafacial muscle range of motion and performance. Handheld percussive massage guns are popular in sport and therapy. People use them to improve flexibility, performance, and recovery. But it's not much science to prove this effect. Therefore, this article is check 5-minute massage of chest muscle made effect on dorsiflexion RM and MVC tour. We have 16 health volunteers and 2 groups, one with massage using hyperbolic device on 5 minutes and 53 Hz, one without. We measure pre-treatment and post-treatment dose diffraction RM and MVC torque. The figure shows the result of MVC. The x-axis is pre and post treatment. The y-axis is MVC. The red bar is percussive massage treatment. The green bar is without massage. The results show us is not change strength after massage. The study conclusion present MVC torque unchanged in both groups, but after massage can improve flexibility. So it's useful to warm up before exercise. Thank you. This is my reference. Thank you, guys.
Thank you for your wonderful presentation. And I have a very quick question. Can you jump to your figure? Yes, and in this figure, very nice. And what kind of comparison is emphasized here? Between or within? Thank you.
Can you say one more time?
Sure. What kind of comparison, between group comparison or within group comparison, is emphasized in this figure?
Compare
Between or within?
between.
Are you sure? Yes, it's a between. Thank you. 好，那我们就下一组吧。下一位。下一位的话是永文吧。一样，你试试看操作，然后OK 了吗？OK. So, let's go.
Hello everyone, my name is Yuan. Today I'm going to talk about a study from 2021 published in the Hong Kong Physical Therapy Journal about the immediate effect of bone roll on hands and ankle range of motions in patients with plantar fasciitis, the randomized control trial. In the background, stretching has been shown to reduce pain and improve range of motions in people with plantar fasciitis, but following effects are still not well studied. Our aim is to compare how foam rolling and stretching affect pain and ankle range of motions in patients. Now about the methods. 50 adults joined. 25 people did foam rolling. 25 people did stretching. We measure their pain and ankle range of motions using simple scales. For result, x-axis is stretching and foam rolling. The y-axis is pain score. Orange bar is before. The blue bar is after. Pain significantly decreased in the both group, especially is foam rolling group. In conclusion, both stretching and foam rolling reduce pain and improve ankle range of motions. However, foam rolling was more effective for relaxing to calf muscles. That means foam rolling can be used as an alternative to stretching. Here is my reference. Thank you for your listening.
Wow. Perfect timing. And I have a very simple question for you. In this study, how many groups were divided and what kind of intervention were received respectively? Thank you. How many groups and what kind of intervention for them?
Two groups.
Two groups.
stretching groups and running foam rolling group.
So stretch, foam rolling, right? Thank you, thank you. 好，那我们就下一位吧。是雅文吗 ？OK 吗？
好。
Ready?
Good morning, my name is Yang. The journal I'm going to present the acute effects of a percussive massage treatment with a hyperbolic device on ventilator muscles range of motion and performance. This article is published at 2020 in the Journal of Sports, Science and Medicine. Percussive massage is increasingly used for therapy and sport performance. Hence improve flexibility, performance, and recovery. Lack of scientific evidence for effect on RM and muscle strength. Investigates finding percussive massage effects on dorsiflexion RM. Design impact on anti-laser MVC2. We have 16 healthy recreational male athletes, excluding lower leg injuries, neuromuscular resort elite athletes. Intervention 5-minute percussive massage on right foot using hyperbolic device. Focus medial gastrocnemius 2.5 minutes, lateral gastrocnemius 2.5 minutes. Control seated 6-minute long massage. Dorsiflexion RM with dynamic monitor. MVC torque of pentaflaser. Pre and post intervention measurement. This figure will show the results. RM increased significantly after massage, but MVC has no difference between percussive massage and control groups. Percussive massage can improve flexibility without reducing muscle strength. We can't recommend it as part of work for athletes. This is my reference. Thank you for listening.
Thank you. Wonderful presentation. And can you go back to the figure? Go back to the figure. Thank you. Yes, this one is very quick. Can you tell us what is the x-axis, the y-axis, and what are the colors mean? Thank you.
We can see the right picture, and we see the blue is pre-test, and the orange is post-test. We can see the figure between has no.
But what is the x-axis and what is the y-axis? Thank you.
And this is the.
Okay, it's the force, right? It's the force. And how about x?
X is the two groups.
Two different groups. Okay, okay. Thank you. So maybe next time you should start from here. Don't forget. Thank you. 好，谢谢三位哈，那我们就可以从前门离开了。我们下一个。小丽可以在前面准备啊，另外两位就帮我做指定的位置，手机要带着哦。Okay. Go。桌上有 pointer， 你可以试试看有没有办法操作前后。timer 看得见吗？
好，可以。
好，两位都已经学好题好了哦，你们要帮我一起听讲义。Are you ready? Here we go.
Hello, ladies and gentlemen. Today, I'm Xiaoli. Today, I'm going to introduce kinesio tapping does not provide additional benefit in patients with chronic low back pain who receive exercise and manual therapy, a randomized controller trial. This journal was published at 2016 at Journal of the Orthopedic and Sport Physical Therapy. Nowadays, many clinical has shown that the exercise and manual therapy are the most effective treatment for low back pain, and a treatment called kinesio tapping, which widely used in physical therapy in order to make the treatment more effective. And what's the purpose of the treatment? The primary goal was to evaluate the effect of adding kinesio tapping into standard physical therapy. The assess include pain intensity, disability, and patient certification. There are 148 patients with chronic non-specific low back pain in this experiment, and randomized assigned 10 treatment course twice a week, and divided them into experiment group with adding kinesio tapping and controller group with standard physical therapy. The pain intensity and disability were measured over 5 weeks period for primary outcome, and secondary outcome will include pain intensity, disability, and patient certification for 3 and 6 months. As we can see, the figure shows the result of the disability. The x-axis include controller group with physical therapy and the experimental group with adding kinesio tapping, and y-axis include disability. The red represent for baseline, the blue is 5 weeks, and green is 3 months, yellow is 6 months. Statistics indicate that the level of the disability slightly improved only at 6 months. And the conclusion shows that kinesio tapping has no significant benefit with physical therapy, and standard physical therapy remain the most effective treatment, most effective standalone treatment. Okay, thank you everyone.
Thank you, wonderful presentation. And can you jump to your figure?
Okay.
I have a very quick question for you. In this figure, what kind of comparison is emphasized here, between or within?
This is between.
Between, okay,
Yes.
okay. Thank you, thank you. 好，那我们就下一位喽。是嘉颖吗？好，那请你试着操作一下 pointer， 看看有没有办法切换前后。两位都 OK 了吗 ？Are you ready？ 往前，这是最后一张。Okay, let's go.
Hi, my name is Sally, and the journal today I'm going to present is the acute effect of the percussive massage treatment with the Hypro device on anti-abrasion muscle strength of function and the performance. This article is published at 2020 in Journal of Sport Science and Medicine. Percussive massage device popular in therapy and sports to improve visibility and recovery, though the scientific validation remain limited. This study examined 5 mini scalp message effect on increased ROM and reducing stress. In both 16 healthy men aged 27 exclude injuries and neuromuscular disorders. participants 5 minute hyper massage at 63 Hz and focus on middle and lateral scalp with sitting and no treatment control. ROM and MVC were measured before and after using standardized thermometer in randomized crossover design. These figures X-axis is MVC, and we have two groups. One group is percussive massage treatment, and the other is control. The blue bar is a PRE, and the gray bar is a POST. This figure shows us the post is significantly higher than the PRE. And the study conclusion tells us the ROM is increased 5.4 degrees and the MVC unchanged after massage. Percussive massage improves visibility and without reducing rates. It is a suitable warm-up tool for athletes. And this is my report. Thank you for this.
Wonderful presentation. Very quick question. In this study, how many groups do we have, and what kind of interventions were assigned to each group? Thank you.
Two groups.
Two groups. And the intervention?
Massage treatment.
Massage treatment.
Control.
How about control? Nothing? I mean, they receive nothing, or what kind of intervention for the control?
Maybe nothing.
You are the presenter, you have to be very sure, right? So they got nothing, right? So the percussive treatment for the experimental and nothing for the control, right? Thank you, thank you. 好，那魏佳，放着就好，放着就好。Are you ready? Okay, let's go.
My name is Moya. Today I'm talking about the acute effect of percussive massage treatment with the hyperdose device on plantar flexion, on the mental motion and the control. The percussive massage device like the hyperdose are increasingly used in therapy and sports, and they believe that they can enhance visibility, performance, and recovery, but there is no scientific evidence. And this study and implement 5 minutes top method to spread down visibility and strength, and compare with the method is first, we got 16 healthy male volunteers to participate, and second is the intervention is 5 minutes healthier method of diet active at 50 Hz, and while the control group are first. And finally, the before and after testing group of dorsiflexion bone and plantar flexion MVC measured using as the kinetic technology. And here's the results. There are two charts. This is wrong and this is MVC. In the x-axis, we have percussive massage and control. And the y-axis is wrong degree and as we see, post in percussive increasing the quality, and the control group are only increasing the quality. And we see conclusion is 5 minutes hypnosis method testing of reaction from like 5.4 degrees, and everything is nothing changed. The chemical relevance is fantastic for improving feasibility without losing strength, and they recommend inclusion in digestive warm up. This is my favorite. Thank you very much.
Nice presentation, and it would be even better if you can speak a little bit louder. Yeah, and very quick question. In the figure, can you jump back to your figure? What kind of comparison is emphasized here? Between or within? Thank you.
Can you tell one more time?
Sure. What kind of comparison is emphasized in your figures? Between group comparison or within group comparison? Between or within? It's between. Okay, thank you.
Thank you very much.
好，那谢谢三位，我们可以从前门离开。谢谢。帮我叫下一组进来，谢谢。好，那以上可以在前面 stand by， 剩下2位，好，把手机要带进来。这边有 pointer， 然后呢，我再放全荧幕，你试试看能不能切换前后站，可以吗？好，好，那我们好，用手机扫描好。那2位已经把13的学号都输进去了吗？13你 OK? Are you good? Nice. Here. Let's go.
Hi everyone, it's today I'm going to present a study titled Initial Tapping does not provide additional benefit in patients with chronic low back pain. The first, let's look at the background. Low back pain is common problem. It affects 39% of people around the world and is one of the most public health concerns. Manual therapy and exercise are recommended treatment, but they only provide moderate improvement. Recently, clinician tapping has become popular, but there isn't enough strong evidence to show that it really helps. The purpose of this study was to find out whether adding clinician tapping to exercise and manual therapy could improve outcome for people with chronic low back pain. Now let's move to the methods. The research includes 148 adults between 80 to 60 years old who has chronic low back pain. Divided into 2 groups: physical therapy and physical therapy plus clinician tapping. Each person attends 10 sessions over 5 weeks, about 2 times per week. Is the results. There was no significant difference between the 2 groups in terms of pain at any time. In fact, at 3 months in 3 months results, kinesia tapping actually shows a slightly better than use kinesia tapping. In conclusion, the study from the kinesia tapping didn't enhance the outcomes of physical therapy. Exercise and manual therapy remains the best treatment for chronic low back pain. So the routine use of kinesia tapping doesn't seem to offer any extra benefits. That's the end of the presentation.
Thank you. Thank you for your presentation. And if you can put your cell phone down, it would be even better. But can you jump back to your figure? Your figure. Your figure, not reference. Figure. The bar chart. Yes. Oh. Next one. Next slide. Yes, here. Don't move. And here, very quick question. In this figure, what is the x-axis? What is the y-axis? And what are the yellow and the blue? Thank you.
X-axis is time.
It's time. Okay.
Y-axis is intensity.
Okay, intensity.
The yellow is only use physical therapy, and blue is use physical therapy plus kinesia tapping.
Okay, so don't forget to do this next time. Okay, perfect. Thank you. 好，那我们就下一位吧。那个燕化，麻烦你喽。可以切换一下，熟悉一下。Everything good? Okay, so are you ready? Perfect. Let's go.
Hello everyone, my name is Wang Yanhua, and today I will talk about the actual effect of a percussive massage treatment with a hyperbole device on plantar face muscle range of motion and performance. The background and the purpose is some people believe hyperbole massage can improve flexibility and recovery, but the research is limited. So this study wants to test if a 5 minutes hyperbole massage could change range of motion and the muscle strength. And the methods need to test the 16 health men, and each person had a 5 minutes massage. And before and after, ankle flexibility and muscle strength were measured. And the results, according to the chart, the range is increased by about 5 degrees, but the muscle strength did not change. So finally, my conclusion is a short hyperbole massage can improve flexibility without reducing strength. So I think it may be used for the warm-up and or physical therapy. And this is my reference.
Wow, that was quick. And I have a very quick question for you. Can you jump back to your figure? Thank you. The bar chart. Yes. I wonder, what is the x-axis? What is the y, the blue, and the orange? Yes.
The x-axis is two groups. It's use method, and this is
Okay.
y is RN.
Okay.
And the blue one is before treatment, and this one is after treatment.
Yes, I think you are totally have enough time for this, right? So don't forget next time. Describe the details first, define the details, and then you can go to all the improvements later. Nice, thank you. 那我们就下一位吧。稍等一下哦。 放它全荧幕，去试试看有没有办法播放。So, are you ready? Nice. Let's go.
Hello everyone, my name is Ryan. Today I'm going to present a research study titled Effect of Adding Kinesiotaping to Physical Therapy for Chronic Low Back Pain. Low back pain is a very common health problem around the world. The physical therapy believes kinesiotaping can reduce pain. So the purpose is to find out whether adding kinesiotaping and manual therapy can provide any benefit for patients with low back pain. The study had 148 adults with chronic low back pain. They have two groups. Group 1 is physical therapy, exercise plus manual therapy. Group 2 is physical therapy plus kinesiotaping. The treatment lasts 10 sessions over 5 weeks. The researcher measured pain intensity and disability at baseline, 5 weeks, 3 months, and 6 months. The result is the two groups improve over time in pain and disability after treatment. However, there was no significant difference between two groups at any time. The study concluded that adding kinesiotaping did not provide any benefit for pain, disability, or satisfaction with treatment. Physical therapy alone that exercise just as effective. This is reference. Thank you for listening.
Perfect timing. Perfect timing. But a very good question for you. Can you jump back to the figure? Thank you. Yes, you three. You never described. I wonder why, and you are the last one. You should see that before, right? What is the X, what is the Y, and what are the colors making?
The x-axis is time.
Yes.
The y-axis is physical. And the orange is physical therapy. And the blue axis, blue box is physical therapy plus kinesiotaping.
Yes, that's perfect. Don't forget to do this next time, okay? Thank you. 谢谢三位，那我们就可以离开了。好，请你把家政的学号数一下，贴在纸上看一下。好，那这边有 pointer， 你可以拿起来试试看前后播放有没有问题。好，会操作对不对？接下来这个是 timer， 我放在这边，你看得见吗？可以哈。好，那凯荣你准备好了吗？可以。好，那家珍你准备好了吗？
还没。
Okay, sorry. Okay, let's go.
Hi everyone, my name is Selma, and today I'm going to talk about kinesiotaping the by additional anti-inflammatory and chronic low back pain. And this is background and purpose. Manual therapy and exercise are the main recommended for treatment low back pain. But nowadays, many people also use kinesiotaping for an extra treatment. This study wants to know if adding kinesiotaping could make the treatment more effective, especially if reduce pain and improving daily function. And this is method. In this research, there are 158 adults with chronic low back pain. They are divided into two groups. One group is exercise and manual therapy, and the other group is the same treatment plus kinesiotherapy. The treatment will sometimes times over 5 weeks, and the research will check on people who didn't know which groups the patients were in. They measure pain and disability after 5 weeks, and again at 3 and 6 months for follow-up. Analysis the result. In this part shows that kinesiotherapy didn't really help. There was no big difference between two groups in pain or disability. Now the y-axis disability and the x-axis groups. There are two groups. One group is PT and the other group is PT plus kinesiotherapy. There was no big difference between the two groups in pain or disability. Actually, at 6 months, the group without taking didn't be better. So the conclusion is exercise and manual therapies are still the most effective treatment, and kinesiotherapy didn't provide extra benefit. In short, if someone has chronic low back pain, they should focus on exercise and manual therapy, not rely too much on typing. And this is rapid. Thank you for listening.
Thank you, Jason. And can you go back to your bar chart? Yes. I wonder in this figure, what is the x-axis? What is the y, and what are these colors? Thank you.
X is group.
Okay. We have what groups do we have?
Two groups.
Mm-hmm.
And red square is baseline. Green square is 5 weeks. And blue square is 3 months. Yellow square is 6 months.
So the colors are different timings, right? Okay, so next time, don't forget to do this before you describe the comparisons, okay? Thank you. 好，那凯宏准备好了吗？你上台吧。还在传。你有需要再给你1分钟调呼吸吗？因为刚好你们这个 session 有一个人没来。我给你1分钟调呼吸，好不好？pointer 在这边。我们给你1分钟哈，你把呼吸调好了。可以哦 ，OK， 家珍这边也 OK，OK，Let's go.
Hello, my name is Song Kai. Today we will talk about the effect of the pre-CP massage therapy with hyperbolic decided on pain-specific muscles. This is background and purpose. Background heading treatment massage design, including using in food and sports. Claiming benefits including improved flexibility, recovery, and performance, but no prior evidence confirms this effect. Purpose is 5-minute precision massage, and we will RN and MVC, and this is method. 16 healthy recovery meal as ready recovery massage and control, and 5-minute treatment, and medial and lateral gastro needs each 2 5 minutes. Pre and post activity for dosing. RN and MVC started, warm up, and control tested control. And this is my result. This is RN, this is MVC, and blue is PRE, and green is post. And this is massages, use massages. This is normal. And conclude 5-minute personal massage including Dominic RN and no significant change in MVC, and suggested import flexible without loss of muscle strength and recovery a square up tone to intravenous safely. Prepared for insult and choosing no it is morally Janssen. And this is result.
Okay, thank you. One suggestion, maybe you can pronounce the words slower and then much more clear. Or I have a little difficulty understand what you are saying, and but still very nice. Thank you. Could you jump back to your bar chart? This time you do the opposite. You defined, but you never explain the results. So according to the range of motion, the left-hand side, what is the results? I mean, improved or not improved? Which group? Thank you. Do you know what I'm asking for? You define the X, you define the Y, but you never explain for in this group improved or not. In the other group, improved or not. You didn't do the comparison. So can you tell us what is the comparison results?就我的意思是你有定义 X 跟 Y， 但你没有告诉我说比较的结果的 comparison. So in the massage group, improved or not?
This is
getting better or no better?
After use massage is greater than before.
Okay.
And control is not
No difference. Okay,
yes,
not
different.
significant
Okay.
difference.
This is RF.
Yes.
MVC.
Okay, that's okay.
Massage is not different than after.
Okay.
And control
Still the same.
yes.
对，这就是我讲的啊，就是你有定义，但是你没有比较。你刚好跟他相反，他比较了，但是没有定义。Very interesting。好，那谢谢两位，我们可以离开了。然后呢，请可以叫下一组吧，谢谢。来，请进，3位，是3位吗？还是2位？3位，好。那小文，你可以拿着 pointer try 一下，然后另外2位帮我做，记得要带你们的手机。
其实是我有放出图片。
那你有寄新的来吗？你有传新的来？
没有，我想说就直接跟你讲，还是有办法直接投上去的。
应该没有办法吧？那你可能要留到最后了，因为你这样突然讲，对啊，没有办法。现在马上换。好，那所以呢？
我现在马上传给你。
我看一下哦。你现在有办法马上传给我吗？
我现在马上传给我，然后请他们先好的。
好 ，OK， 那我请庭轩。庭轩是0，好，谢谢。OK。Pointer 在前面，你试试看有没有办法前后切换同一边。这边。这是 Pointer 啊，你切换看看。还有，稍等一下哦。好，来切换看看。那 那两位，请我帮我扫一下桌上 QR code， 你要帮我评分哦。这个是 timer， 我放在这边，你看得见吗？
看见。
你就说那边吧，这样做的比较方便。好，那庭轩的学号两位都输好了 ？OK，Are you ready? Let's go.
My name is Jian Tingshen. The journal I present today is Immediate Effect of Foam Roller on Hand and Ankle Range of Motion in Patients with Plantar Fasciitis, a randomized control trial. Stretching can improve fasciitis, and we don't have many articles on foam rolling. So the article is compare foam rolling and stretching to evaluate pain reduction and ankle ROA improvement. We have 50 patients with foam fasciitis and 25 for stretching and 25 for foam rolling. In a single treatment season for both timing. The measurement is pain, PPTS, and ROA. The figure shows the result of VAS. The x-axis is stretching and foam roller. The y-axis is VAS. The blue one is pre-treatment. The red one is post-treatment. So we can see both groups significant improvement after treatment. So the study conclusion is both stretching and foam rolling reduce pain and improves ROM. However, foam rolling is little bit better than stretching. This is reference. Thank you.
Oh, perfect timing. And I have a very quick question for you. Can you jump back to your bar chart? Yes. And in your figure, what kind of comparison is emphasized? Between or within? In your bar chart.
Before and after.
So it's a within group comparison or between group comparison?
Between group.
It's a between group comparison? Okay. Thank you.
要怎么切换？
好，那我们接下来。
OK， 老师，我有比较完整，我可以再讲。
不用。因为祖传是会做扣线的事，哎，你传？
是可以问一下你的信箱吗？还是我要传回来？
可以，传在现在会比较快看。
是问一下。
那不然我们还是先第三位好不好？来，那你有需要这边吗？要坐这边，好，帮我评分。输好了吗？上面有学号，然后QR code扫一下，评分的表格在那里。Is that ready? Good. Let's go.
Hi, I'm Lisa. Today I will present the good effect of reduced message treatment with the hyperbolic design on plantar flexor muscles, range of motion and performance. The background. Acute message device like hyperbolas are popular in sports and therapy. They are
believed to improve respiratory and recovery, but research advice is still recommended. As a purpose, this study tested if a 5-minute hyperbaric carbon message could increase ankle respiratory without reducing stress. Muscles. We have 16 healthy men participants each received a 5-minute carbon message at 53 Hz and the control session without massage. Researchers measured dorsal pressure range of motion and muscle strength before and after treatment. Result. The figure shows the effect of acute surgery on ROM and MVC. On x-axis, there are 4 confusions, and on the y-axis.
Keep going. Keep going.
And the y-axis, measurement value. The blue bar is dorsal pressure ROM, and the right bar is MVC. And we can see the ROM increase from about 25 to 30, and the MVC is almost the same, around 120. This means the hyperbaric massage improves respiratory without reducing muscle strength. So the conclusion: a short hyperbaric massage can safely improve respiratory without reducing strength, making it a useful warm-up tool for athletes and therapists.
Okay, so thank you for your presentation. And a very quick question: can you jump back to the bar chart? Yes, in this figure, next time if I were you, I will try to separate the MVC data with the ROM data. They will 2 figures. One is ROM, one is MVC. Do not combine them together, or it's a little bit complicated to understand. Okay, so my question is, how many groups do you have in this study, and what interventions were given for different groups? How many groups and what interventions?
4.
You have 4 different groups? Okay, so what interventions were given? OK， 文善，谢谢。好，传了吗？
传。
哦，切换一下，看会不会操作。So are you ready? Are you guys ready? Okay, here we go.
Hello everyone, my name is Huang Shangwan. Today my topic is immediate effects of forearm pain and ankle range of motion in healthy patients with anti-pressures randomized control trials. And the changing will improve pain and ROM in pain time. And there is limited research fungal defects. So they want to compare fungal and the stringent on pain and the ankle out in plantar fasciitis. The 550 plantar with plantar fascia, and they have two groups. One is stringent group and another is fungal group. Their conclusion is and then their PP is for gastromembrane, solid earth, and the plantar fascia. And their result is both of research will reduce pain and improve ROM, and there is a significant increase in aggressive tremendous and solid. This means the pain decrease and the stringing is no higher and the fungal is decreased. There is reference.
Okay. Thank you. One suggestion: maybe you should put your bar chart before the conclusion, not after the conclusion. You understand what I'm saying? Yes. 那个会变顺序。Okay, can you jump back to the bar chart? Thank you. So, in this study, stretching bone roller, what kind of comparison is emphasized in this bar chart? What kind of comparison is emphasized here? Between or within? Yes. There are two types of comparison, between different groups or within same group. And I wonder what type is emphasized here? Between group, within group, which one?
This is within group and where this is emphasized group.
Okay, interesting. 好，那谢谢三位，我们可以离开。然后呢，帮我叫下一次，好，谢谢。陈琦，好，谢谢。那你会是第一位，剩下两位用手机帮我扫一下 QR code。那陈琦的学号在上面，这个 monitor， 然后我现在全荧幕试试看有没有办法。当然。你看看会不会切换前后张投影片，会不会操作？可以吗？这个是 timer， 看得到吗？有一点勉强。好，那两位 OK 了吗？Okay, let's go.
Hello everyone, my name is Ashley. Today I'm here to talk about a study on kinesio tapping and chronic low back pain. And when it comes to the background is exercise and manual therapy are the best ways to treat the back pain. But kinesio tapping is very popular and people use it to try and get better results. And the goal of this study was very simple, and it is, does adding the kinesio tapping really help the back pain and moving better when the patients are already doing the physical therapy? And next one to talk about is method. There are 148 patients with long-term low back pain. and they divided into 2 groups, and both the groups got the same treatment, and it is 10 times of exercise and manual therapy. And they check for 2 main things. The first is how pain they felt, and the second is how easy it was to move. And they check this after 5 weeks, and then again after 3 months and 6 months. And the next one to talk is the bar chart. As you can see from this chart, this chart shows the pain score. And first we look the red bars, and both the groups had a high pain. And we move to the green bars. See how much the pain dropped, and most groups improved a lot. And the green bars, the pain is dropped very many. And
let's keep going. Keep going.
And let's move to the conclusion. And so what did they find? They find there is no differences in pain or moving better between the 2 groups. So the kinesiotherapy didn't help them more when the patient's already doing the physical therapy. And this is the end of my presentation. Thanks for listening.
Thank you. Wonderful presentation. And one quick question. Can you jump back to the bar chart? Yes, that was very quick. So I wonder, what is the x-axis, what is the y, and what are those beautiful colors?
X-axis is the treatment time, and the
y-axis is what? Check again.
It's the KT group and the control group.
It's the group.
And the y-axis is the pain score, yes, from 0 to 10. The 10 is the high.
Yes.
And the red color is the baseline, and the green color is the 5 weeks, and the blue color, and the purple is about 3 months and 6 months.
Okay.
After.
So maybe next time you should go from here first and jump into the comparison later. Okay, don't forget that.
Thank you.
Thank you. 好，那于安，麻烦你了。Try it. Are you ready?
Okay.
Perfect. Let's go.
Good morning, everyone. I am Yuan. Today I will talk about the study of kinesio tapping for long-term low back pain. We know that exercise and hands-on therapies are recommended for back pain. Kinesio tapping is also very common. The study asks a simple question: is treatment kinesio with kinesio tapping better than without kinesio tapping? And so the results took 148 patients with chronic non-stiff low back pain. They made 2 groups. The control groups, 10 sessions of exercise and manual therapy, and intervention group get the same 10 sessions of patients, but also get kinesio tapping. Okay, now let's look at the results on the graph. The y-axis is a disability score. Remember, it's a low down, more down, and more better. Look at the 5 weeks. Both groups get matched to 14 to 9, but the 2 groups are not very different. This brings us to the conclusion. The study found no significant difference between 2 groups. What does this mean for us? It means added kinesio tapping to exercise and manual therapy provide no extra benefit for patients. And the tap did not seem to add any extra help. Thank you.
Thank you. Perfect timing. And one suggestion, in your slide, you try to mix the results with the conclusion. It's very creative, but I have to say, it might be a little confusing sometimes. So, if I were you, I would try to avoid this. I will separate that into different slides, the results and the conclusion separately. Okay, so not a big deal. And here, I still have some question. It seems you didn't describe the axis and the colors, and maybe you should tell us about the details.
The blue line is control groups.
Okay, blue line control.
And the yellow line is intervention groups.
Intervention groups.
Yes.
And how about the x-axis?
X is 10 points. And 5 weeks, 3 months, and 6 months.
Yes. So how about the...
what is the disability score?
Okay, the higher the worse,
higher,
right?
Yes.
So
and lower is better.
Next time, don't forget to do this before you jump into the comparison. Yes, don't forget. 好，谢谢。那童林，麻烦你喽。来，稍等一下，我把你的画面开出来。Are you ready? Let's go.
Hello everyone. Today I want to talk about the message gun. Message gun like Hypervolt are very popular now. And many people use them to go around before exercise and relax later. But we don't really know if they work. So the research want to know if 5 minutes message can help the more ankle flexible, and also check the muscle weaker or not. So they find 60 men about 27 years old to join the test. Each person do 2 times. One time they just do nothing. One time they do the 5 minutes message. And before and after, measure their RF and FTC. The results show that after the message, flexibility increased about 5 degrees, then the muscle strength are changed. So a short message can make your leg more flexible, but it doesn't make you weaker. The reason might be that the message helps the muscle relax and make it easier to stretch. So a 5 minutes message is good and fast warm up before your exercise. Very good.
Okay, Tony, that's a very quick presentation. So, can you jump back to the bar charts? Thank you. Yes, very beautiful bar chart, but you seem totally didn't explain this. So, for the left-hand side, the range of motion 1, can you describe the X, the Y, the colors, and tell us the comparison results? Thank you. How about we start from the X, the X-axis?
Before doing the message, and this is
before after.
The y-axis is degree, is your flexibility. And this is
No, you don't have to go to the right-hand side. Just stick to the left-hand side. And how about the colors, the blue and the deep orange? What do they mean?
The blue is do message. Orange is do nothing.
Okay, so can you make some comparisons? Can you do some comparisons and tell us what can we learn from this range of motion results?
You can see from the blue flexibility is about 5 degrees increase.
Okay. Which group?
Experiment. Control group is stay the same.
Okay. So massage gun is effective in improving flexibility, right? That's what you should do, right? 这个就是你刚才报的时候可以做的哈。OK, thank you. 好，那感谢3位，我们可以离开。那帮我叫下一组。好，那区诗柔吗？来，那你可以在前面 stand by， 桌上有 pointer， 另外2位手机有带着吗？帮我扫一下 QR code。那诗柔的学号你在上面。pointer 你可以试一下，前后切换投影片。会吗？好，那 timer 在这边，看得见吗？
可以。
OK， 那2位你们 OK 吗 ？OK，let's go.
Hello everyone, my name is Shishiro, and the journal I'm going to present today is the acute effect of a recursive massage treatment with a hyperbolic device on anti-pressure muscle range of motion and performance. Hand pre-sub massage has become popular in BFB and sport to improve flexibility, performance, and recovery. In this study, we want to see whether a 5-minute powerful percussive treatment affects ankle, ROM, and MVC. And the method is Hence visit the live class with a 2-day interval at the same time of day. And there are 2 conditions: percussive massage and control trial in radian order. And we mention dorsal ROM and the MVC of the carpal muscle before and after each season. And this design allows us to compare the effect of the massage versus the control on flexibility and muscle stretch. And this is result. The Y line is ROM degrees and X line is 2 groups before and after difference. And for flexibility, the massage group increased 5.4 degrees or 18%, and while the control group didn't change much. So this shows the massage clearly helps increase ROM. And in the other hand, muscle strength didn't change in 2 groups. So although the massage is effective for flexibility, it doesn't have an immediate effect on carpal strength. So in our study, 5 minutes calf massage increased ROM but didn't change muscle strength. So including this massage in a workout can improve flexibility without affecting performance. And this is my PPT. Thank you.
Thank you. Wonderful. And can you jump back to the bar chart? Thank you. Yes, in this one, one suggestion, maybe next time you should use different colors, not the same series. Brown, 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 brown. It can make the comparison more easier. Do you understand what I'm saying? All the colors are brown, not very distinctive. Okay. So one question in your figure, what kind of comparison is emphasized between group? or within group? Which one? In your bar chart. Thank you.
2.
Are you sure? OK, thank you. 好，那我们就请俊哲。So are you ready? Let's go.
Hello everyone, I'm Ho Junzi. Today I will talk about a study about foam rolling and stretching for hair pain. Plantar fasciitis causes hair pain in many adults. Stretching is known to help, but foam rolling is new method with less research. The aim was to compare which one works better for hand and ankle motion. And step 2. Result. 15 patients joined the study. They were divided into 2 groups, stretching and foam roller. Both worked on the calf and foot for 45 seconds, 5 times. Hand and ankle motion were measured before and after treatment. And next, result. Both groups improved. Hand dropped from 5.3 to 2.7 in the stretching group, and from 5.5 to 2.5 in the front roller group. So both were effective, where front rolling was a little better. And slide 5. Both methods reduced pain and improved ankle motion. Foam rolling may be slightly more effective for calf muscle. This is an easy and useful self-treatment. And slide 6. Thank you. This is my presentation.
Thank you. Wonderful, wonderful. And perfect timing also. One quick question. Can you jump back to your bar chart? Your bar chart. Yes. Yes. Stay. Oh. Yes. Stay here. And it seems you didn't describe the x-axis, the y-axis, and the colors. So can you do this for us? Thank you. Yes, you didn't do this, right?
The x-axis shows different groups. And the y-axis...
Here you don't have to keep looking your tablet, right? You can just watch the slide and describe, right?
And the y-axis shows VAS.
Okay, how about the colors? The colors, you have blue and green.
The blue is for stretching, and green is post.
Before, after, right?
Before, after.
Yes, so that's you should do at the very beginning, okay? Don't forget next time. Describe, and then you jump to the comparison. Oh, improve, okay?
Okay.
Perfect. 好，那燕迪，麻烦你。那这样会折扣哦，你 OK 哦？
要不然我用旧版可以？
对啊，我是你的话，我会就用旧的就好了。除非它真的差很多。Pointer 在桌上吧。好，你试试看播放。好，那你能不能前后切换 ？So are you ready? Let's go.
My name is Huang Yun. This is a copy of the journal I'm going to present today. And first, let's talk about the background. The background is manual therapy and exercise are effective treatment for low back pain.
Financial tapping is increasing used to enhance this effect. And the purpose is to evaluate if aiding financial tapping improve outcomes in chronic non-specific low back pain patients. And this study involves 148 patients with chronic non-specific low back pain. And this study was divided into two groups. The first group is control group, means exercise and plus manual therapy 10 sessions and twice a week. And the other group is experimental group, which represents same program and plus financial tapping to lower back. And it's this measurement. Primary is pain intensity and disability at 5 weeks. And secondary is pain disability 3 and 6 months. Satisfaction perceived effect. And it's a result. Primary outcome is no significant difference in pain and or disability at 5 weeks between groups. Secondary outcome is no group difference at 3 or 6 months or more mentioned. Exception, slightly lower disability at 6 months in control group. Overall finding, adding financial tapping didn't improve clinical outcome over standard therapy. And this trial focused on disability. We can see minor difference in disability at 6 months favor control group. In the end, is the conclusion. Study conclusion is financial tapping provide no and additional benefit over exercise and manual therapy. And clinical relevance, exercise and manual therapy remain core treatment for chronic non-specific low back pain. Final this are my reference. Thank you for listening.
Thank you. Can you jump back to the bar chart? Yes. Yes, you use two different colors, blue and orange. I wonder, what's the difference? What do blue mean? What do orange mean? Thank you. Yeah. No. I mean, you have blue one. You have blue. You have orange. What does that mean? What does blue mean? What does orange mean? Yes.
Blue means 5 weeks and 3 months, and orange means 6 months. And
I know, but why 6 months? Use orange. You can use green. You can use blue, right? But why you choose orange?
It have a significant change.
So it's significant. Yeah. So you mark it with orange. Very good. Thank you. 好，那谢谢三位。分组打完就可以开了。谢谢老师。帮我把这个撕下来好不好？小心哦，不要把纸撕破了。这个我还要再用。
那我们要去的。
啊？你帮我把门上的那一张撕下来。谢谢。